Hey fam, this is Dr. Tasha. Um, Coming at y'all in light of Breast Cancer Awareness Month, which is October, and my dog might be turned up a little bit this evening, so if she starts barking, excuse me. Um, Okay, so I wanted to let you guys know that it is, I'm sure you already know, but it's Breast Cancer Awareness Month. And I want to speak to the importance of getting tested, getting screening. Forgive me, I'm chilling, I'm laying in my bed, but it still doesn't prevent me from coming at you guys to let you know how important it is. Now, say hi, Zoe. Say hi, Zoe. Okay. So, essentially, for Breast Cancer Awareness Month, something that I'm promoting, and I force all of my patients, I don't care who you are, 8 to 80, crippling crazy, you're going to have your mammogram. And I don't take no for an answer, and I will document in your chart if you say that you refuse to have it done. But essentially, any woman, your first mammogram should be at the age of 37. That's when you get your baseline mammogram. The only exception is if you have a strong family history of breast cancer. So they say you should be tested 5 years before the youngest person in your family was diagnosed, or 37 for your baseline. And then once you turn 40, it should be yearly. Okay. Please, please, please. It is very, very important. You know, we listen to a lot of statistics that separate race and socioeconomics and things like that. For all of you ladies who may not have health insurance and you want a mammogram, the Cancer Centers of America offers a $99 mammogram for those who do not have insurance, or their insurance is so poor that you'd end up essentially paying for the whole mammogram, which is kind of expensive yourself. Then please hit up the Cancer Centers of America and they can give you a mammogram for $99. Okay, so it's no reason for anybody not to be screened. Do not think that it is not it's not you. Oh, I breastfed, I'm not gonna get breast cancer. I had an aunt that said that to me, and I had to get her right together. So please don't think it can't be you. I have a 19-year-old in my practice, excuse me, a 23-year-old who was diagnosed with breast cancer when she was 19. I literally, I don't know, this has to be like the youngest case ever. It really does. But she ended up having a double mastectomy, which saved her life. And she's thriving and very, very happy at this point. You know, a lot of times we tend to feel like it can't be us. I do definitely agree with the fact that there's a race disparity with breast cancer, and there's a good reason why. And I usually will tell my patients, and please don't think that I'm being racist with this. I'm drawing a point. And I'm not stereotyping, I'm drawing a point. And at the end of this, if you get the point, I've done my job. Okay. So I usually will say Sylvia Rubenstein. And I think you guys understand what I'm trying to say. But Sylvia Rubenstein will feel a lump. She'll be like, "Ooh, there's a lump," and she'll go to her doctor, point out the lump, go get imaging and testing, and subsequently, she will find whatever it is and go on about her business, get it treated, get it dealt with, and move on. And these are not absolutes, these are generalizations. Please understand that. And then we have Cynthia Robinson, who again, you all understand where I'm coming from with that. Will fill a lump and say, "Oh well, it's fine, it's not bothering me, I don't think it's anything, I'm gonna just watch it and I'll watch it and I'll watch it and I'll watch it." And with so many things on her plate, or fear of a diagnosis, or lack of trust for healthcare, which trust me guys, there are lots of acceptable reasons to not trust, but you have enough people of color in medicine that you should be able to find somebody that, hopefully you can find somebody that you trust, so that you can get the appropriate care, and not hold I guess stereotypes or fears or whatever against the entire medical community, so that you can make sure that you are following up with your care. But anyway, so Cynthia Robinson is going to go on ahead and finally have it evaluated once it hasn't gone away. It's gotten larger. She's felt it. Now it's paining her. So something that she noticed at stage 1 or 2 now is at 3 or 4, and her chances of survival are significantly less. So please, guys, time is of the essence, and it's very important when we're talking about breast cancer when we're talking about breast cancer screening. And it's very important that you go, you swallow your fears. People say all the time, oh, it's going to squeeze my breast. It's going to hurt. It's going to hurt a whole lot less than breast cancer. Oh, it's going to rupture my implants. No, there's a special way in which they do the screening if you have breast implants over and under the muscle. So please don't be afraid of that. And I had to learn that myself because I was very reluctant. I would send my patients with breast implants to have an MRI until the radiologist actually called me, and he's like, you do realize you're wasting resources. We can do whatever type of mammogram for people who have implants. So there's no excuse for anybody. Definitely, if you have a family history, talk to your doctor. If they haven't spoken to you, please talk to your doctor about BRCA. BRCA being BRCA, yes, BRCA gene testing, and that's the gene that will let you know if you're at increased risk of developing breast cancer. When you heard of Angelina Jolie, she didn't have breast cancer, but she had, sorry guys, she didn't have breast cancer, but she had both of her breasts removed because she was gene positive. And that's very important for your children. If you are female and you're gene positive, you may not have breast cancer, but if the gene is there, you're at increased risk for getting it. And you have to also be mindful to educate your daughters about being tested. So there's a lot that comes with this, and there are a lot of ways, and science has advanced so much, and there are a lot of ways that we go above and beyond to try to have early prevention to keep you guys safe and alive. So please don't be afraid. Find me, find another provider, find somebody you're comfortable with, and please get tested. If you don't have any insurance, $99 will do the trick. No, I don't have any affiliation with Cancer Centers of America. I don't work for them. I don't work with them. And shout out to them for doing an amazing job and helping you ladies without insurance get screened. But I know about the program. Obviously, as a gynecologist, I try and make it my business to learn about everything that's going to help my patients, insured, uninsured, whatever the case may be. So please, guys, if nobody has told you how important it is, if you've just been letting your health care dwindle, you just had a lot on your plate, a lot on your spirit, you've had a lot going on in your life, you can't be there for the people that you love if you are not in a healthy place yourself. So please take it from Dr. Tosha. Go and get screened. Don't be afraid. You'll be fine. Very rarely are there things that we find that we can't address early on and move on and have good health with. But fear is a big thing. Fear is a factor, if that's a saying. Just please go and get screened, guys, okay? Stay healthy and happy Breast Cancer Awareness Month, y'all.